Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I don't know if you know anyone that has Parkinson's disease. I remember going to the Volin Center once, and they had a whole caregivers day where they had someone with Parkinson's, and then they had the caregiver, and of course people were either shuffling or they were kind of shaking or moving. And it was the first time, this must have been 15 years ago, that I realized that Parkinson's is pretty important, that they'd have a whole support group. But after talking to our next guest, Leslie Curtis, who of course is in this field of taking care of people, she's a nurse and she's really up to date on things, she started telling me about Parkinson's. So what were you saying?
Well, Parkinson's is a disease process that, and again, it's a neurological disease, but people that are afflicted can have acute exacerbations, which means they get worse for a while, and then with some rehab, they get better. They can end up where, like you said, the shuffling gait or inability to walk, period, as the disease progresses. Swallowing disorders, Parkinson's, dementia. It's truly one of those diseases that some people don't get it that bad and others do. Very difficult for the caregivers. You know, if they're living at home, very difficult. There can be incontinence. I mean, it's a tough disease. And the patient themselves can be totally with it and realize that they can't control their movement. And there are certainly there's support groups, the Parkinson's Association. But there
must be drugs too that help.
There's drugs, and there's a lot of new drugs out. A lot of new drugs out for Parkinson's. And because they're so new, I don't know how effective they are. We're just starting to see them come in. And there's one or two. There's a home health agency that we work with that the gentleman, one of the gentlemen that owns it is a physical therapist, and he deals a lot with the Parkinson's patients. They're certified to deal with them. So it is a specialty, but it's a tough disease process. There's also multiple sclerosis. You know, I believe there's over 100 different forms of MS.
Really?
And Earth Green used to deal.
Are some more serious than others?
There's the ones that are recurrent, and they just get progressively worse. And again, you know, how could you not be depressed as you continue to get worse and you can no longer walk? You know, you might have all your faculties, but you can no longer do the things that you used to do. Muscular dystrophy. You know, as the baby boomers are aging, we're starting to see more and more of these kinds of people coming in because people survive longer now. So it's not, you know, they're there.
So are there people who have what they assume is Alzheimer's or some form of dementia and also having Parkinson's?
Yes. And again, it can be a Parkinson's, dementia. And then you throw in depression that goes along with that, with any of these chronic neurological disorders. You know, you can't do what you used to do. So there's the depression, the anxiety, the anger, as well as the disease process. So it's sad, you know, and, you know, we do our best with activities and different things like that to help get them out of that mode, psychiatry, psychology. But they're tough diseases. They really are. And like I said, it's very tough on the caregiver.
Wow. And does this just come on somebody very quickly?
No. It's usually gradual. I mean, I think a lot of times the first time somebody's admitted, well, I shouldn't just say it, with MS, they've had a real decline in weakness, and then they're diagnosed. And it used to be they couldn't even diagnose them right away. Same with Parkinson's. A lot of times people will come in with aspiration pneumonia, and then they're diagnosed with Parkinson's. They didn't even realize that they had. They figured they're just getting older, so they're weaker, or, you know, things like that. So if you notice a change in yourself, you know, go see your doctor, because there are things that can be done, and there's a lot of new medications out there to help. And it's better to know what you're going to be looking at than to end up in the hospital with, an acute event and you don't even know why.
And I would assume the sooner that you catch it, the more help people can be given. I had an aunt who was of my mother and her sisters. There are three of them. And this particular aunt was more physical. I mean, she did more things than the others. She played golf. She did a lot of things. She fell off a curb. And, and we figured, okay, and she got home and she recuperated. But she then had an arm that wasn't moving well. And then it got worse, and she really was almost like a cripple, and it went up towards her. She couldn't do anything with it. It went up towards her body, like in a sling, right? And she actually was diagnosed with Parkinson's, a form of Parkinson's. And that really it was strange for me. How could this woman, who was doing fine, and then because of an accident, this all happened? Now, have you ever heard of that?
No, but it doesn't surprise me, because
she was in her 80s.
She was in her 80s, and she went through a trauma. So, it's not just the part of your body that got hurt that is in trauma. So I'm kind of assuming, I'm not a physician, but that, it could exacerbate a pre-existing condition that you're not even aware you have. It's like, the people that have surgery and the anesthesia, and it takes them a long time to, get back to themselves. Other people, of course, do very well. But, all these things, it
deals with the brain, right?
Right.
That's what you started.
Right.
This whole show is on neurological disorders.
Yeah, it's, strokes, any of those things that can be acute onset, and then they start to diagnose other things that the patient may have had that they weren't even aware of. Hypertension. If you don't go see your doctor, you may not know you have hypertension. And if it's at those unsafe levels, there comes the stroke or, things like that. So,
well, I've been talking with Leslie Curtis because I trust her so much, and she's very smart, and she is very involved. She's the director of business development at Regents Park at Boca Raton. And so she's surrounded by all this, and yet she's not oblivious to what can happen to her friends, or anyone. Yeah. As one ages, has to be careful where you step off.
Yeah.
What you eat, what you used to be able to get away with, and now you can't do that anymore. You have to be very careful. And just recently, I was really, I was amazed at how important sleep is. And I just went to a global conference, and I'll be talking about this in Boomer Times soon, about the happiness quotient and how we have to find happiness. But the other thing, they went very, very strong about sleep.
Oh, it's very important. You need that REM time, to dream and do whatever you do when you're sleeping. But it is important, and stop and think about patients that have gone through something. They don't sleep well. And it's tough on them, because you can give them medication, but they're not in their own bed, and medication might make them confused. So that's a tough, tricky subject.
Yeah, and enough sleep. It isn't just, they want you to really get about 8 hours of sleep. And I remember that my husband was really at 10 o'clock, no matter what it was, unless it was really unusual, he went to sleep at 10 o'clock. And there's stories about we were maybe having a dinner party or something, and he excused himself, and we all figured he went to the bathroom. He came back out in his pajamas. And he said, well, I'm going to sleep. You all can just stay and enjoy yourself. And he always did that.
He was the smart one.
He was. And he always asked me when he would go to bed, are you coming to sleep? Well, I wasn't tired. I wanted to watch more TV. I had things to do. I said, no, I'll see you later. It wasn't something, but I keep saying I'm going to try to do it. but it seems like something always kinds of happened. But it was one of my goals. I'm not being very good with my goals. Walking more, sleeping, longer hours.
Yeah.
But I bring that up because I think that probably that's all a very healthy thing to do. And maybe if somebody doesn't have one of these diseases yet and they take really good care of their body, it doesn't awaken.
I would agree. I mean, I think that, or it might be later. Taking care of ourselves is not always that easy. The sleep quotient, I mean, come on. I'm going to go to sleep at 10. That's not going to happen.
But if you go to sleep at 11, but then you have to sleep 8 hours, that means you won't get up until what, 7? 8? If you go to bed at 11, right, you're going to get up at
11 to 7.
Right.
And we don't get up at 7. We get up at 5 or whatever.
Right, even earlier. There's some times that I've gotten up because of walking the dog, and then it never would have happened before, but I might just go back to sleep if I don't have to be somewhere because I've missed that 1 hour.
Right.
But so I think a lot of people are awakening to what they have to do with their body and trying. We can't always be perfect, but we know our diets, meaning what we eat, how we think, how about depression. You were talking about that also. Yeah. There are support groups. I know you have a lot of them at Regents Park, where you can actually go and get help in a lot of ways.
You can, and not enough people actually take advantage. They really don't. And like I said, it's more for caregivers, support groups, than the actual patient, depending on their condition.
Well, let me just tell everyone, Regents Park is, in Boca Raton, it is really an exceptional place. Look, it's not a palace. You don't go and have dances and parties there and drink. It's really for rehab or for people who really need care. So of all the ones that you're going to find around, it's probably, if not the best, it's one of the very best in South Florida. And the way for you to find that out would be to really go there. And I'm going to give you a phone number that you can call Leslie, and you can make an appointment and go see her, because that's the way to find out about a place. 561-483-9282. 561-483-9282. And let me tell you something about the industry. There are a lot of people, this is a business discussion. Everyone is in a business and hopefully will make money. So there are discharge planners at hospitals. There are discharge planners at medical centers. And they will tell you where they think you ought to go. It may not be Regents Park because maybe they don't have an affiliation there. So this is one instance where you have to take this on yourself. Know enough that when something happens to a friend, a family member, yourself, you could say, no, I don't want to go there. I want to go to Regents Park because I know what they're like there.
Right. Absolutely right. Yeah, I mean, especially nowadays, hospitals are not contracted, but have affiliations with different skilled facilities. And they may not want you to go to a certain one because they're sending their patients all to one facility, or at least they're trying. But the patient has rights. So you have to just be strong.
And actually, Medicare takes care of the money if it's appropriate. Mm-hmm. So you could go to the best, like Regents Park, or you could go to some little place that doesn't have any of the benefits, and Medicare is going to pay there also.
Well, they're going to pay the same thing.
Right. So, but people don't understand any of this. As a matter of fact, and I have to say that my darling husband did go to Regents Park, and I was amazed at the very end that I really didn't have a little bill for my food, but I didn't have a bill. And I thought someone made a big mistake. But I guess they didn't make a mistake.
No.
And here I was at a place that was not a palace, as I always use the word. There are no palaces like this, but there are really first-class places. It's like even the Ritz-Carlton is not a palace, but it's really top of the line. I always refer to Regents Park as like a Ritz-Carlton. I did that because I think that they have a lot of very nice things there. You do?
Yeah, we do. We do. The grounds are, I mean, it's a
really
very comfortable place to be if you have to be somewhere.
Yeah. So let's get back to this neurological disorder situation. How does someone know? Let's say they're home, and how do they know something's happening to them? Just like they know if you're going to have a heart attack, there are signs. If you're going to have cancer, there are signs. So you'll see things. What are the signs for neurological disorders?
Usually there might be a gait imbalance where they realize they can't walk as well as they used to. Maybe they're losing...
What does that mean? They can't walk. What happens?
They're shuffling their feet. They don't feel steady. Falls. A lot of times you'll find someone that's falling frequently, and they don't know why.
They're not falling over their dog like
no,
Charlie tries to get in my way, right?
Right, just kind of falling. There's so many different things. Their arms might not work as well as they used to, and those are all signs that something is going on. They need to go see their physician and figure out what it is.
Right. One thing that I do want to urge people to, when you talked about falls, if you don't have grab bars in your bathroom, it is very dangerous for you to take a shower or a bath, especially a bath, because you'll never get up. We actually are renting, and I paid for grab bars in both our bathrooms because the first thing you grab would be, if you don't have one, you grab the soap dish that's right there, or you grab the shower at the top or something.
Right, the window ledge.
So grab bars are really important, and I know that there at Regents Park you have the grab bars, of course, in the bathroom, even when someone sits on a toilet. And I know all these things are required, but they're not required in your home. But you should think about getting them.
Oh, absolutely, because...
Do you have any in your house? No. Probably not. Should think about it.
Yeah, I have, believe me.
Yeah, because there's some that aren't so expensive, they kind of stick on.
Yeah.
But I actually had someone come and put them in, with nails, with screws, and they're beautiful, and I feel so secure now when I take a shower because I didn't feel insecure, but I said, okay, what if something should happen, especially now that I am alone, I really need to have that security.
Yeah.
So...
No, it's true. When my kids all move out, I'll be alone. So
yeah, but even now, grab bars are very important because, people aren't always in our home.
Well, and a slip and slide in the shower or bathtub is not uncommon.
I know that.
You see the commercial with "Help Me, I Can't Get Up."
But I know people who've really they hit their head against the bathroom, the toilet, the seat, or the bathtub. No, so it's really important, and so. It's one thing, as you said, people get certain signs that make them think that something's not right, but we have to prevent things.
Right.
Prevention is just so important, isn't it?
Yeah, and as we get older, it becomes more and more important. And we have a lot more knowledge now than our parents did. I don't even know if they had grab bars back then.
Only when you went to hospitals.
Yeah.
I don't think it did do that, but that's right. But now we do know that. I'll tell you something else, though. My husband Bill had a phone, a simple phone that had a security button. You push it and it's like it goes directly somewhere, and then they know where you are. And he used it one time because he got on the floor. He didn't slip on the floor and didn't fall, but he wound up on the floor. And he couldn't get up. He wasn't strong enough to get up, and his arms wouldn't get him up. And he called, and then so the EMT came, and they helped him get up. But I've kept that now, and I have it. It's an extra phone, and I don't have to carry it. I don't have to worry to have one of those little
life alerts.
It is a life alert on a phone. I don't use that all the time, but he used to always beg me, please, when you go out, take the phone, and I do take it. So. Those are the kinds of things, that, I'm older than you, but I'm in very good health, but I'm going to take precautions. In fact, there's another precaution that's getting off. It's not to do with the neurological, but a lot of us are single and we're home alone.
Right.
And so I have a friend. We both call each other somewhere between 7 and 9 in the morning. Well, no, we do it on a text.
Right.
We say, GM, good morning. What are you doing today, or are you okay? And if the other person didn't respond, we would pursue it.
Right. I've done that with my friend.
Oh, good.
Yeah.
And so this is all part of, you don't have to wait for a neurological disorder to happen.
No.
It might prevent it.
Right. And, most people have cell phones now. So, we tell them keep it right by your bedside. God forbid something happens during the night, it's right there. Not everybody has an alert system of some kind, but, that helps. Because they can call a friend, they can call 911. And sometimes it is something where they can reach their phone, but other times, if they're down on the ground, or they've had a stroke or they've had something major, they're not going to be able to get to a phone. So,
yeah. So the neurological disorders. So let's itemize them again. You started out saying Parkinson's, I guess ALS.
Mm-hmm. Yeah.
And then to have fibromyalgia isn't that's no, that's a body thing. Okay, and then of course stroke, Alzheimer's, or some other dementia,
MS,
multiple sclerosis, MS. What else? Did we miss any?
Like I said, we've got I think one.
Well, actually, depression is really a neurological disorder, is it not? If it's caused by a chemical in your body, not just because.
Well, it's a side effect of most of these neurological disorders. You wouldn't be depressed if you didn't have a neurological disorder. So,
but wait a minute.
But
if someone who loses a spouse or they lose a child and they get depressed,
but it's not a neurological thing. It's emotional, and it can certainly end up being, again, when you have a secondary neurological disorder of any kind, that depression, sadness, feelings of being alone, not wanting to go out. These are all things that people go through because they think they look funny, or they can't walk properly, or now they have to use a walker. So these are all things and that's why you go to rehab, so you can learn to navigate the community, if possible.
I'm glad you brought up the walker situation, because so many people are, whether they're embarrassed or they want to be strong, and if they don't use a walker, and they should, they're going to go down.
Oh, yeah. It's just a matter of when.
Right, and canes don't do it. It's not the same.
No, I mean, some people can progress to a cane and they're safe, but other people really need to use their walkers, and there's so many different kinds of walkers now.
Right.
There's the 2-wheel, the 3-wheel, the 4-wheel, and again, you have people that might have whatever condition and they need oxygen now. Well, you need a certain kind of walker to accommodate carrying the oxygen with you. So there's so many different things to learn, which again, those are usually our short-term patients that are, dealing with those kinds of things, and the caregivers.
Well, I'm not going to give the name, because we have a new advertiser, as a matter of fact, that will be coming in the next couple of months, and they have a medical supply store.
Okay.
And I find medical supply stores fascinating. You can get you get things for everything that you didn't even know you need, but will make your life easier.
Splints.
I'm going to get something to hold my stomach in. I think they have things like that. It's a big rubber. It's like a big something that goes around your back, your stomach, and it makes you stand up straight.
Oh,
I'm going to look for one of those. I think I saw it advertised somewhere. I'm saying this because you got to look at yourself, and you have to see how you can be better. They have the stockings now too,
right,
which are really important. I know as a nurse, you have been on your feet so much. Maybe now in your capacity, you're not on your feet.
Not as much.
As an executive, but a lot of these other people are.
All day long.
And do they use these stockings?
Some of them do. It depends, on their condition. Some of them do, some of them don't.
The doctors even doctors use them if they're on their feet, even if they don't have a particular problem, just to keep the circulation going.
Yeah, well, again, as we get older,
right,
things change.
That's a very good statement, that people want to look good, and they can look good, but something happens to the body that just doesn't function. But that's why we're trying to eat better. We're trying to exercise more to keep that body stronger.
Yeah, walking.
Well, someone can sit in a chair and use the weights, just sit in the
Right.
chair and let the weights go up and
Absolutely.
down. There's lots of things. And there are people who walk their dogs. I think dogs are great because if you have a dog, you have to get up in the morning, right?
Yep. Got to get up and walk them.
Feed them.
Feed them. Walk them. When you get home from work, you got to walk them. Yeah, it does force you. I had a Jack Russell for a short period of time.
Oh,
my
yeah.
Lord.
Right. I like our Shih Tzus better.
Oh, yeah.
They're-
I had to find a home for it because it was eating my Shih Tzu. I mean, it was horrible. But that thing, I would walk that thing for 45 minutes to an hour in the morning, in the evening, before bed. Nothing wore that dog out.
Yeah.
Nothing. So if you're going to get a dog,
Right.
make sure you get the right.
Exactly for what you're doing.
Yeah.
But the dog is good. And also we talked a little bit about depression. Boy, aren't dogs wonderful for depression?
Oh, yeah.
Well, I love talking to Leslie. She is very, she's a nurse, as I've said, and she's skilled, but she has a very kind heart. And because of that, we're so happy that she's a part of our Boomer family. The phone number to call again is 561-483-9282, or you can just get online, go to regentsparkboca.com, regentsparkboca.com. Thank you for coming in.
Thank you.